Hi, today we're going to talk about a question that I get asked all the time and one of the main reasons I see consults in clinic, and that's babies that wheeze. What causes wheezing? Well, wheezing can be caused by many things. The most common one is airway infection or airway inflammation and or airway hyperreactivity. What does that mean? There is muscle in your airway that gets sensitized to different stimuli, and then it kind of like constricts, making your airway narrower, and it's like the wind blowing through the creak of a window, and you make that whistling or wheezing sound. And that can be caused by viral infections, bacterial infections, and also can be caused by other things like anatomical or structural anomalies of the child's airway. Can be caused by a foreign body. Then I get asked, if my child is wheezing, how do we treat that? Well, it's not uncommon for your doctor to give you some breathing medications to try to open up those airways and see how your child will respond. We typically don't diagnose asthma in infants or in preschool children because there are a lot of preschool children that will wheeze in the first few years of life. And we always give them one chance. If they continue to have wheezing, then some of those children will be at risk for future development of asthma. So if your child has wheezing, or if you suspect that your child is wheezing, talk to your doctor to see what therapies you can use to relieve those symptoms, and then ask the questions about what is it that we're looking for to determine whether your child is at risk for asthma development in the future.